Annette. I just realized in the last week someone has tried to introduce me to the pulsed electromagnetic field machines by Bemer. There are multiple manufacturers with different features. This is getting to be a big deal because they are saying that NASA is incorporating this technology into spacesuits in the future, or at least they're experimenting with it to see how it works. The claim is that it increases circulation, and fibromyalgia is mentioned on their websites. So I don't know if Dr. Congdon has received a question about it yet, but I think it would be important to know if it's a fly-by-night situation or something valuable. Yes, I have had a Bemer treatment. Just as the question said, it is a mat that you lie on that's supposed to increase circulation. And there's a chiropractor that I'm in a networking group with, and she uses the Bemer on a lot of her patients, some with fibromyalgia, anybody that comes to her with problems in their musculoskeletal system. She finds good results with the Bemer. It gave me a really bad migraine, and so it wasn't something that I'd like to rush back to. But the idea of increasing circulation to our cells is a very important concept in general, because when you increase circulation to cells, they're going to get more blood, they're going to feel better, and it's going to allow waste products to be removed better, more effectively, more easily. So yes, for some people the Bemer might be effective. It's super expensive. Some people have purchased the mat. It's I think it's $5,000. But they go to chiropractors or other people who own a Bemer, and then they pay for the treatment. Has anybody here had a Bemer treatment? One. Okay. All right. So it's. And do you live on the island?
I did when I had it.
Okay. There you go. So it's around. So the other things that can increase circulation, exercise, right? That's the most important thing. And guaifenesin. Guaifenesin, because it is getting into all of our cells, and Dr. Saint-Amant found, and I have found that to be the case, water rushes in when we clear, and oftentimes we have swelling, and blood is rushing in with the water as well, and it is cleaning out the cells of the phosphate and whatever gunk might be there. So exercise and guaifenesin, and perhaps other things that increase circulation. There are a lot of wearable tech devices now. You just Google wearable tech for fibromyalgia, and you'll see a lot of them. And some of these may also increase blood flow. I have been asked to test one of these devices, and I've been using it on and off for a month, and I think it does decrease swelling in my neck and shoulders. That's pretty much the only place where I might have some pain. And their technology says that it does decrease inflammation, increase blood flow. So, but this is something where you hardly ever hear about someone who has fibromyalgia, uses one of these products, and then it's like, oh, I'm better. So something like the Bemer or a wearable tech device would be an adjunct, something that you would use if, let's say, you had severe shoulder pain, maybe from an injury, and you've got fibromyalgia in that area, and you could put the wearable tech device on your shoulder, and with its neurostimulation, that's what it does. It provides electromagnetic pulses that are supposed to, number one, confuse the pain pulses that go to your nervous system. You know, if you hit your elbow, if you rub it, it doesn't hurt as much, same idea. But certain of these devices are supposed to increase blood flow. So that might be an adjunctive therapy, but it's hardly ever something that someone will say, oh, I have terrible fibromyalgia, and I use the Bemer, I'm totally better.